Hello, my name is Fofi Constantinidou and I come to you from the University of Cyprus. I would like to thank the organizers for the opportunity to participate in this special retirement celebration honoring Ali Vakil. Dear Professor Vakil, dear Ali, congratulations for reaching this important milestone in your personal life and in your career. I have great respect for Professor Vakil. Ali, you're a prolific researcher in neuropsychology and in particular memory and brain injury rehabilitation. Your work has been influential internationally. I use your publication in my courses and it has guided our research at the university, as you will see in a few minutes. In addition to a great researcher, Ali is a great mentor. And a testament to that is the accomplishment of his mentees, who are now accomplished faculty and clinicians themselves. On a personal level, you're a great collaborator, a loyal friend, an individual with great integrity and generosity. Additionally, your love for your wife, Tammy, and dedication to your family are evident to all of us and guide your actions. So great package, great researcher, great mentor and teacher, great collaborator and friend, great family man. So Tamar has asked me to provide a brief research presentation. I contemplated as to how to approach this brief presentation. And I thought to provide a more integrative perspective as to how I think things are progressing in terms of brain injury research and rehabilitation, and offer some of my insights in that perspective. And also share with you some more of our current research at the University of Cyprus. So I will be sharing my screen. So hopefully this is showing okay. So I'm going to focus for the next few minutes on ABI and neurorehabilitation in the modern era, some challenges and opportunities. Some of the work that I will be presenting, it's an integration of our research from Miami University, where I spent the first half of my career, and the University of Cyprus, where I have been in the second part of my career to date. I come to you from the Center for Applied Neuroscience. The center was established in 2011, and our vision is to be the flagship center for neuroscience research and collaboration in the greater geographical region. And within that, the mission of the center is to conduct basic and applied research and contribute to the development of new knowledge, methods, and technologies that advance science and benefit health and quality of life and society in general. So there are some unique benefits in conducting brain health research in Cyprus. Cyprus has a population of about 1,000 people, has a small geographical area. It is an island country, so it reduces sample attrition. There's some unique social cultural characteristics, low divorce rates, strong family involvement, similar to Israel in that respect. It is relatively genetically homogeneous population due to centuries of isolation, being an island country. The golden standard, unfortunately, is fragmented rehabilitation system without systematic comprehensive rehabilitation at the acute, subacute, or post-acute stage. And community and vocational integration programs are lacking significantly in Cyprus. In this particular study, we investigated outcomes in a cohort of chronic patients with moderate to severe traumatic brain injury, where we saw significant brain atrophy, significant deficits in executive functioning, verbal and visual memory, and pointing to the fact that traumatic brain injury continues to pose significant deficits or limitations several years post-injury, and also resulting in significant brain atrophy in a frontotemporal manner, which explains some of the executive functioning and memory deficits that we continue to see on our neuropsychological assessment. In a larger sample of more than 100 individuals that we are currently investigating, only 38% of brain injury survivors in the chronic phase show good recovery using a very gross measure, the GOC, the Galveston Outcome Scale. The rest of our participants in our study demonstrate moderate to severe disability. Undoubtedly, traumatic brain injury is of global and subsequently European epidemic. The numbers continue to rise. And here you can see on this slide, you can see green, neurotrauma. The blue is Alzheimer's disease. The orange is cardiovascular disease, and the black is infections. And this is a scale plotting the percentage of years of loss to disability, and traumatic brain injury or neurotrauma is the leading cause. The costs are over 33 billion euros per year for traumatic brain injury. About 10% of those diagnosed with dementia have a history of TBI, and we know that TBI is the strongest predictor for dementia in terms of a medical cause posing significant risk for developing dementia later on. So investigating through the research and our success as a field, I was able to delineate 6 key challenges of traumatic brain injury. The first challenge is that it is of high burden and of high prevalence, as we saw in the previous slide. The second challenge is that it results in long-term disability and poor outcomes overall. The third challenge is that acquired brain injury is a chronic condition. It is not an event that occurred and now it's resolved. It results in a neurodegenerative cascade affecting the brain, affecting the endocrine system, affecting musculoskeletal function, urinary function, reproductive systems, and it puts the individual at risk for a host of difficulties that some of them will appear in a delayed manner. Unfortunately, the fourth challenge relates to inadequate access to proper care. Despite significant advancements in acute medical management, we continue to see great disparities in terms of proper rehabilitation care, not only across nations, but also within nations. The fifth challenge is that successful reintegration seems to be elusive. We do have cases of success, undoubtedly, and the prevention programs have also been very fruitful. However, overall, reintegration seems to be elusive, probably because of inadequate access to proper care. And we need to do a better job in that domain. The sixth challenge is difficulty to develop predictive models for patient management or tools for measuring outcomes. They're currently lacking. Part of the problem is that we're approaching traumatic brain injury and predictor models in a more linear fashion, whereas we know that perhaps we should not be using linear methodologies to predict outcome. The other challenge relates to the measures that we use to predict outcomes. So more effort needs to be done in this area. But like anything else, challenges also generate opportunities. And so the following opportunities are clear to me in terms of how we can make progress in acquired brain injury. The rehabilitation community has been focusing during the past 20 years in identifying evidence-based neurorehabilitation methodologies to improve injury outcomes and reduce burden. And there are systematic reviews, and there are efforts in developing those theory-driven rehabilitation programs, which leads to opportunity number 2, to improve cognitive performance and social abilities to maximize reintegration. And we are working towards that direction. The third opportunity is the development of systems to shift the share of responsibility to the survivor. Holistic programs focus in this area in the need and the necessity to shift the individual's abilities to return to pre-injury independence. During the early stages of recovery, the therapists and the caregivers share the burden of responsibility. But for rehabilitation to be successful, the individual needs to share the responsibility. And this shift is of paramount importance, and we need to develop systems to help the patients share this responsibility. Number 4, the fourth opportunity is to establish screening and prevention programs and give particular emphasis to vulnerable groups, for instance, athletes. Victims of domestic violence, and we're currently in Cyprus implementing a project exploring traumatic brain injury in females who are victims of domestic violence. The 5th opportunity is to join forces around the globe for large cohort studies, because in order to develop and generate predictive models of recovery of ABI, we need to have high powered studies and contribute towards personalized treatment. And the effort of the International Interdisciplinary Special Interest Group, one of our objectives is to bring researchers together and share knowledge. And we had the honor in 2015 for Ellie to come to Dallas and deliver a very well-received presentation on memory assessment in traumatic brain injury. And he was a recipient of our Brooker Award lecture, and which is the flagship event of the International Interdisciplinary Special Interest Group. So congratulations and thank you, Eli, for being with us at ACRM. So currently our projects investigating acquired brain injury in Cyprus, we have 2 projects, and one is called AKESO, which investigates traumatic brain injury and stroke. And the other one is called Brain Rehab, which investigates traumatic brain injury exclusively. They're both funded by the Cyprus Research and Innovation Foundation competitive grants. Now, we know that cognitive rehabilitation is at the center of rehabilitation efforts. And in this article, we explored the association between brain reserve, cognitive reserve, and neuropsychological and functional outcomes in males with chronic, moderate to severe TBI. The lead author here is my postdoc, Eva Betemeridou, and this paper was influenced by a suggestion made by Eli during Eva's dissertation defense to look at cognitive reserve across time since injury. And so this is another example of Eli's contribution to the research. in this paper, we saw that time since injury affects negatively cognitive reserve, and it is related to brain reserve measures. So again, this neurodegenerative cascade that is set off by moderate to severe traumatic brain injury is of utmost importance, and cognitive rehabilitation hopefully can provide a way to combat this neurodegeneration. So currently we're implementing 2 treatment modalities. One is the categorization program. This is a program we developed in my lab at Miami University. And it is a systematic hierarchical cognitive rehabilitation program. It is delivered individually on one-to-one basis. But the more recent program that we have developed, and we're currently testing its feasibility on an outpatient basis, is the social communication training module, which is designed to complement the more intense neurocognitive program delivered through the categorization program, and focus on psychosocial skills, promote effective communication strategies, and improve self-awareness. Because again, this shift in sharing the responsibility for implementing strategies and improvement. So we use group sessions, role play, and the neurobehavioral domains are communication, self-awareness, and social skills. So we're currently investigating this approach. The innovation model of this research includes multi-domain predictor variables, neurobiological, psychosocial variables, and we are aiming to implement a multidimensional predictor of recovery and outcomes using more cutting-edge analytical methods such as machine learning and artificial intelligence, and trying to approach the prediction in a non-linear manner. So I'm going to close off with a case study. I'm sure it will, this case study will sound very familiar to our audience, where we have George, a 38-year-old walking wounded, sustained a traumatic brain injury 6 years ago in a motor vehicle crash, has a bachelor's degree in information technology, but he became unemployed after the injury. He still lives with his mother, and he has difficulty in creating and maintaining romantic relationships and receives full disability benefits. So we have a health problem leading to job instability, leading to dependence, to social difficulties and social expenses. The solution by our multimodal approach at the center is to provide a thorough assessment, provide interactive treatment, gradual return to work and maintain job stability, independence in managing daily finances, and then training of social and gradual social reintegration. And the estimated savings based on financial analysis of benefits of rehabilitation is estimated to be at about 500,000 euros across George's lifetime. So these numbers speak for themselves and speak for the importance of rehabilitation or effective rehabilitation. So in closing, I'd like to invite you to Cyprus. We are proud to organize the first conference in Cyprus on communication disorders. I have the honor to be the president of the National Speech Language Association. And it is in July in Nicosia. We're currently calling for abstracts due on April 25th, and our early bird registration ends on June 3rd. And these are a few photos of Eli at the ACRM conference I mentioned, where he received the Brooker Award. And this is from his last trip to Cyprus was December of 2017 for Eva Betemeridu's dissertation. But Eli, hopefully we'll see you in Cyprus within the next 12 months from Michelle's dissertation defense, where again, Eli's work has been influential and it's related to the brain rehab study that I just presented. And I would like to thank you, Toda. And these are some of the members of our research team. And of course, acknowledging always our funding sources. So again, thank you for the invitation. Dear Eli, congratulations. I'm sure you'll continue your productive career and hopefully you'll have time to have fun and travel and come and visit us in Cyprus with Tammy. Thank you all.